Hello guys, welcome to our videos on home remedies. Today we have come up with a very practical topic on vestibular exercise or balance exercise that can be done at home. To start with, you have to first go to the ENT doctor if you have balance problem or a neurologist, and after you are thoroughly evaluated and diagnosed, then the doctor will tell you what type of balance problem you have, what type of vestibular disorder you have. Then the exercise will be based on the diagnosis. Start the exercise at home. There is risk that your giddiness, the vertigo may become worse initially because you are stimulating the balance organ by the exercises. So you should be prepared that you may sometime vomit, or you need a friend nearby, you may sometime fall down. So don't do this exercise when you are alone. Before we jump to the different type of exercises we'll do for different disorders, I'll give you a slight background on how balance works so that you know the importance of the exercises. Balance is a very complex mechanism. It gets input from the brain, and there is a small brain called cerebellum at the back. So that is the main coordinating center. Then you get input from the ear. There are three semicircular canals, ventricle and saccule, and both the ears, that they are one of the most important organs of balance. And you get input from the eyes, and also you get input from the joints, different joints in the legs and the body, and also the skin touch. So brain will combine all these things together, and it knows what is the position of the body, whether your body is balanced or not. What can you do in order to correct that balance posture? When you have the ears, that they are one of the most important organs of balance, and you get input from the eyes, and also you get input from the joints, different joints in the legs and the body, and also the skin touch. So brain will combine all these things together, and it knows what is the position of the body, whether your body is balanced or not. What can you do in order to correct that balance posture? When you have severe spinning sensation and vertigo or balance problem, you will not be able to do this exercise. You will have to go to the hospital, get appropriate treatment, medication. Once that severe nausea, vomiting, spinning sensation is gone with the medication, let me tell you that medication will only suppress the acute episode of spinning sensation or the vomiting. It is not going to cure your illness. The cure is exercise. That's the importance of the exercise. So initially, when you have acute episode, you go to the hospital, take the medication to suppress your acute spinning sensation. Once that has gone off, then you have to do series of exercise at home, and it may take few months. So you should be committed to do this exercise regularly for a few months in order to get the, because the body has to compensate. For example, one of the ear has become weak, the balance organ has become weak. The eyes, the muscle, the joint, and also the brain has to take that extra load because one of the organ is not functioning. And you have, by series of strengthening exercises, it has to be able to take up that function, which will obviously take time. Videos, links, YouTubes, you'll find so many different types of exercises, and some are quite complicated and it's not able to do at home. Here we'll try to simplify as much as possible and just do what's possible at home, which you can do without any medical assistance. We'll start with general vestibular exercise, how to strengthen the eye, the ear, the muscles in the neck, the joints. So we'll do that exercise. It's known as the cooksey vestibular exercise. To start with, let's do the eye tracking exercise for the eyes. Okay, you have to do this 10 times. Then you can go to the vestibulo-ocular reflex, that is the to strengthen the your ear. Then you can do other exercise for the muscle and the neck. So you'll be first doing in the sitting posture, because when you get initially vertigo, the spinning sensation, with medication you have become a bit all right. You may not be able to stand. Then how to do the exercise? So you have to sit like this, and you can do the exercise in the sitting posture. Once you are comfortable after a few weeks or a month, that you are able to now stand on your own, and if you feel you're confident that you will not fall down, then you can stand and do the exercise in the standing posture. So you will always start with the sitting posture first. So eye tracking exercise number one. Uh, Take the pen about a feet or two away from your eyes here. Your eyes should be fixed at the tip of the pen. Your head is fixed, only the pen moves. I will follow the tip of the pen. So with the eye is always fixed to the tip of the pen. Your head posture is fixed, only the pen moves. Pen goes to the right, I will follow it to the extreme right. I'll bring to the center. Slowly I'll take all the way to the left and slowly bring to the center. I'll take it up. I'll come down to the center and I'll take it down and bring back to the center. The eye is fixed to the tip of the pen all the time. So you can do this uh, eye tracking exercise for 10 times. Left, right, up, down, like that, 10 times you do. Now, number 2, once you complete this eye tracking exercise, you can now fix the pen this time and the head moves. Earlier, the head was fixed, the pen was moving. This time, the pen is fixed, the head moves. Again, the eye is all the time fixed to the tip of the pen. So I fix to the tip of the pen. I turn my head to the right all the way. Slowly I bring back to the center. Slowly I go all the way to the left. Slowly I come back to the center. Slowly I go to the top. Slowly I come to the center. Slowly I go down. Slowly I come to the center. Initially do slowly, and once you are confident you can do faster, like that. Now you do again this one 10 times. The next is the movement of the shoulder. So joints and muscle has to be strengthened as well. So what you do, roll your shoulder in front, roll the shoulder in back, roll the shoulder in front, rotate to the back. Like that you rotate for 10 times again. Then you get an object and then place it on the floor, pick it up with the right hand. Place it to the left hand, place it on the floor, pick up with the left hand. Okay, so these are the series of exercise that you will do in sitting posture. Once you are confident of this, in that okay, now I'll be probably able to stand, you can stand, then you will do the same exercise in the standing posture. In addition to this, you have to do you have to sit and stand. So first with the eyes open your eyes and stand, sit, stand, sit, like that you do 10 times. Once you are confident about doing this, and for a few days you try this, then you can do stand, rotate to the left, sit down, stand, rotate to the right, sit down. So you can do this 10 times each. You can do some other exercise in standing posture, which I'll show you. So now in standing posture, look at the tip of the pen, the head rotates. After that, shoulder movement to the front, shoulder movement at the back. You can also tilt the head to the left shoulder, come up, tilt the head to the right shoulder, come up. Then you can pass the object from left hand to right hand at the level of the eye. Like this, like this. Initially just go closer, you may not be able to catch because your balance is distorted. Later on, you can throw, as you are more confident, you can throw like that. And then at the level of eye, you do 10 times. After that, you have to pass it left leg in front and cross to the left hand like that. Right leg in front, underneath the leg you cross, in front of the knee joint, at the back of the knee joint. Like that you pass the object 10 times. Cowthorn cooksey vestibular exercise that you do first in the sitting posture and then in the standing posture. Another commonest cause of vertigo, the spinning sensation, is the BPPV, benign paroxysmal positional vertigo. So I'll tell you three different exercises for BPPV because there are three semicircular canals inside the ear. So it can be right or the left. So problem can be in either of the semicircular canal, either in the right ear or in the left ear. So the exercise slightly differs from each other. So the posterior canal is common is 90% of the time. It's the posterior canal is involved. So you can do Brandt Daroff home exercise for BPPV. Less commonly, lateral canal is involved. There you have to do lateral canal log rolling exercise. And rarely the superior canal is involved where you can do the head hanging exercise. There are so many other exercises. You can forget about them because they are quite complicated and you may not be able to do it correctly. So we'll start with the posterior canal home exercise, Brandt Daroff home exercise for BPPV because the posterior canal is the commonest. So what you do is take a hand and place it like a pillow like this. So if you are doing for the left side, you have to rotate. Don't rotate the head all the way to the shoulder like that. You just do 45 degrees. This is 90 degree if you rotate all the way from front like this. So that's 90 degree. You just rotate half, 45 degree. So place it on the left side, rotate half, then lie on one side of the bed like that. Your head should be up, fixed to a point. In the ceiling, you just look at a point and wait for half a minute or till your giddiness goes off. So you just fix this position for half a minute or till your giddiness goes off. Okay, I am no more giddy. I have now come back to this position and wait for another half a minute. Then rotate to the left at 45 degrees, not fully 90, just make it 45, half rotation like that. And then I'll go to the right side. And now I'll look at a fixed point in the ceiling and sit here for half a minute. Okay, I'm no more giddy. I'll come back and sit in this position for another half a minute. So half minute down, up half minute, half minute, half minute. That makes 2 minutes in total. That's one cycle. You have to do this 10 times. This exercise is for posterior canal BPPV. If your doctor has diagnosed you with posterior canal BPPV, this is what you are going to do. Now, let's do log rolling exercise for lateral canal BPPV. For lateral canal, what you do is go to the bed, sleep. Now, if you have right lateral canal problem, you start with the right. Okay, I'm having right lateral canal BPPV, so I'll start with the right side. I'm feeling giddy. I'll wait for half a minute. Okay, half a minute is gone. I don't feel giddy anymore. I go up. I don't feel giddy. Half a minute is gone. I'll turn to this side. I'm no more giddy. I'll go this side. I don't feel giddy anymore. I'll come back to the original position like this. So start with here. Half minute, half minute, half minute, half minute, half minute. So 1, 2, 3, 4, 5. That makes 2.5 minutes for lateral canal to complete one rotation. And you can do that 10 times. So that's for lateral canal BPP. For superior canal, you have to head hanging exercise, and superior canal are very rare unless, very few people will have that problem. So hang the head like that from the bed. If you have a friend, they can give a support to your head, and wait till your giddiness goes off. After giddiness goes off, with the chin will touch the chest. Sit like that, and you can do repeatedly, around 10 times you can do that as well.